So what are CBMs? Well, it's good to look at the anatomy first, as we're all here looking at it from a scientific perspective, but CBMs are derived, or cannabinoids are derived from the cannabis plant, and generally speaking you have two plants. You have the male plant and the female plant. That's one way to look at it. And we're talking about the female plant here when we're deriving the active substances, the cannabinoids. If you zoom into the flower of the female plant, you see a few different colors, but you see these small little white structures, and when you zoom in even further, there are these sort of quite cool looking glandular structures, and it's within these glandular structures that these cannabinoids are produced, and because they're from a plant, we call them phytocannabinoids. You've probably come across the terms before. Two different cannabinoids produced in the plant are CBD and THC. THC is an interesting one. It's psychotropic, works on the central nervous system. Generally used for recreational purposes, or stereotypically used for recreational purposes. And then you have CBD on the other hand, which is a non-psychotropic, I guess very simple molecule, and they actually do polar opposite things. But these are two hot topics, and I thought I'd mention them already. But it doesn't stop there with the cannabinoids, because we have THC, CBD, CBN, CBG, and the list really goes on. I believe to date there are 118 different cannabinoids that have been discovered. And what you can see in the first two examples is that these cannabinoids start off as acids in the plant, and through heating or UV light they get activated from their acidic form into their oxidative form. In addition to the cannabinoids, you also come across terpenes in these plants. So myrcene, you see that in clove and mango as well, and has anti-inflammatory and sedative properties. Linalool in lavender is antidepressant, limonene, antiseptic. And these are things that we come across, and these particular terpenes give cannabis or cannabinoids a distinct taste and flavor or smell. So we're talking about, in the medical sense, repurposing these molecules to turn them into medicines. And it's interesting because I'm not the first person to talk about this, nor are my colleagues from the last 100 years, because around 12,000 BC it was first postulated to be domesticated. The plant has been tied into a lot of ancient stories of medicinal or healthcare use in addition to the spiritual use. So this stuff's been around for a very long time.